Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Sudden hearing loss in one ear. What you need to know and how to seek help. Experiencing sudden hearing loss in one ear can be frustrating. Fortunately, about half of people who have sudden hearing loss regain their hearing without treatment, and 75% recover their hearing with treatment. /r/n/r/n There are two types of sudden hearing loss. Sudden conductive hearing loss is caused by earwax or another blockage. Sudden sensorineural hearing loss, SSHL, which is less common, is caused by a loss of sensitivity in the nerves. It can be caused by a tumor, a head trauma, or other health problems. /r/n/r/n Sudden hearing loss may also accompany other symptoms, including ringing ears, tinnitus, and dizziness. /r/n/r/n Continue reading to learn more about hearing loss or sudden muffled hearing in one ear, including how to fix it and whether you can expect your hearing to improve. /r/n/r/nAscentXmedia, Getty Imagesrnrn The most common symptom of sudden hearing loss in one ear is not being able to hear as well out of that ear. Some people will experience total hearing loss, while others will experience a muffled sound or a reduction in hearing. /r/n/r/n Oftentimes, people wake up with sudden hearing loss, but it doesn't always occur first thing in the morning. The hearing loss may not occur all at once, but over several days. It may come on with the following symptoms, /r/n/r/n In most cases, people never identify the cause of their sudden hearing loss. However, sudden hearing loss can broadly be divided into two categories: sudden sensorineural hearing loss, SSHL, and sudden conductive hearing loss. /r/n/r/nSSHL is the most common type of sudden hearing loss in one ear, although some people will experience it in both ears. SSHL is caused by loss of sensitivity in the nerves in the ears. /r/n/r/n Only about 10% to 15% of people with SSHL have a clear reason for the loss of hearing. The most common causes of SSHL, when they're able to be identified, are /r/n/r/n Sudden hearing loss can also be caused by /r/n/r/n Conductive hearing loss happens when something blocks sound from permeating the ear. Usually, materials like earwax or fluid build up over time, so the hearing loss is not sudden. However, people may experience sudden conductive hearing loss if they have a foreign object in their ear or an injury to the eardrum. /r/n/r/nSSHL is an emergency, and should be treated immediately with a trip to the emergency room. Conductive hearing loss is not an emergency, although it may require prompt medical attention. Try the hum test to see what type of hearing loss you're experiencing. If you hum and the noise is louder in the ear with normal hearing, you are experiencing SSHL and should seek emergency medical care. If the hum sounds louder in the ear that has hearing loss, you're experiencing conductive hearing loss. You should call your healthcare provider, but do not need to go to the emergency room. /r/n/r/n Sudden hearing loss is diagnosed using a hearing test called pure tone audiometry. You have hearing loss if you experience a loss of 30 decibels, the level of the sound of a nearby whisper of sound. If normal conversation sounds like whispering, you're experiencing hearing loss. /r/n/r/n Once healthcare providers have diagnosed you with hearing loss, they may do other tests to determine why it has occurred. They'll often examine your ears to rule out conductive hearing loss. Then, they may order a magnetic resonance imaging scan, MRI, and blood tests to find the root cause. /r/n/r/n If you're experiencing conductive hearing loss, the healthcare provider will help remove whatever is blocking your hearing. That might mean removing a foreign object from your ear, or clearing earwax. /r/n/r/n The treatment for SSHL is more complicated. Corticosteroids, either injected or taken in pill form, are the most common treatment, especially if your healthcare provider doesn't know what's causing the SSHL/R/N/R/N. If your healthcare provider can identify the underlying cause of SSHL, they will treat it. They may prescribe antibiotics if they think a bacterial infection is contributing to your hearing loss. If a tumor is causing the hearing loss, they may recommend surgery to remove it. Healthcare providers can prescribe drugs to suppress the immune system for autoimmune diseases. /R/N/R/N people can regain their hearing with treatment, but if your hearing doesn't return, your healthcare provider may recommend hearing aids to help you cope with the sudden hearing loss. /R/N/R/N you should always see a healthcare provider when you experience sudden hearing loss in one ear. Early treatment is important, especially if the loss comes on suddenly or you believe you might be experiencing SSHL. People who delay treatment are less likely to regain their hearing, so seeing a healthcare provider soon is crucial. /R/N/R/N There are two types of sudden hearing loss in one ear. The most common is caused by sudden sensorineural hearing loss. Sometimes, sudden hearing loss can be caused by a blockage from earwax or a foreign object. Most people regain their hearing after sudden hearing loss, but it's important to see a healthcare provider promptly. Your chances of regaining your hearing are best if you get treatment quickly. /R/N/R/N, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.